Hello, welcome everyone. Thanks folks for joining us for our session. My name is Saskia Harak. I'm the Executive Director of Jane Addams Senior Caucus in Chicago. I'm going to be talking with Larry Stafford of Progressive Maryland, who we'll hear from in just a second, for this session about why the fight for Medicare for all must be a fight for racial justice. And first, we'll introduce ourselves. So as I said, Saskia Harak, my pronouns are she, her, and I'm with the Jane Addams Senior Caucus. Caucus is an organization of seniors in Chicago working on housing and healthcare justice. And the call to work on Medicare for all for us really bubbled up from our membership of seniors. And since then, been working with our friends in Chicago and across the People's Action Network to take bold steps in the campaign. We are part of a powerful interruption of the American Medical Association Conference in 2019, sharing healthcare stories and raising up the need for Medicare for all. We've also pushed local members of Congress to sign on in support of federal legislation and are now making sure that we are focused on base building and bringing more seniors into the fight. Larry, welcome. Want to introduce yourself?
Yeah, of course. Thank you so much, Saskia. My name is Larry Stafford Jr. I'm the Executive Director of Progressive Maryland. We're the state affiliate of People's Action within the state of Maryland. We're a community-based political organization that works to organize the multiracial working class in order to take control of our lives in the state of Maryland, take control of the functions of government so that we have a government that truly serves the majority of people. And we've been working on this issue of Medicare for all and health justice more broadly over the past few years, also moving our members of Congress in the state to sign on in support of Medicare for all as well, and also fighting other health justice issues such as fighting for an end of the practice of hospitals suing for medical debt, and working to engage the multiracial working class on that particular issue. And we've been getting some victories as well in that fight, changing the way that hospitals are able to sue for medical debt. And also currently we're in the struggle to get people reimbursed for money that should have never been taken out of their pockets from hospitals going after them for debt. So I'm really glad to be here along with you.
Wow, that's super powerful. Thanks for sharing about those campaigns, Larry. And we both have mentioned People's Action. So just to bring that into the room, both of our organizations, as we said, are affiliates of People's Action. It's a network of 40 community organizations across 35 states working on economic justice, racial justice, environmental justice issues. The roots of the organization, of the network, are over 40 years old, and currently we're most focused on winning healthcare for all, combating the war on drugs, addressing the overdose crisis, winning a homes guarantee, and just always making sure that we're putting people and planet first. And this powerful network of progressive groups brings us together so that we're learning from each other, we're strategizing together and taking action collectively on our shared vision. So very excited to be here with my organization and also with People's Action. So let's get into it. Larry, we're here, to discuss how the fight for Medicare for all is also a fight for racial justice. Why is that important to you?
So for me, it goes beyond just the fact of, my own experience just being a Black man myself, but also like witnessing like what happens in our community, from hypertension and diabetes being like prevalent in causes of, early death in the community as well, preventative illnesses taking people out, and that's also happened in my family as well. So my story, in terms of one thing that like really made me think about like the interconnection of Medicare for all and the fight for racial justice was something very personal to me with my aunt who was actually my mother's twin sister, who passed away a couple of years back, and passed away from cancer. And the whole story of it really starts with the fact of the way I look at it is that, like, again, I said, like, my mom and her were twins, and they grew up in the same household, had the same, kind of upbringing. But my mother wound up able to go into the military. My aunt always had, some struggles with like finding like super gainful employment or a very long-term career. And, they just wound up on different economic paths in terms of as they grew older in life. My aunt never really had consistent or stable healthcare. She lived in rural Virginia and always worked jobs where either she was very part-time or doing some type of contract work and did not have healthcare. And in fact, one of the reasons we feel that she wound up passing away was ultimately because what we found out during the time that she passed, as my mother was going down to the hospital and I was on phone calls with her, this cancer had been developing within her body for some time, actually. We don't even know exactly how long, but from talking to some of her children and other family members, we discovered that she had been dealing with like pain in certain parts of her body. She had swelling going on with her arm, actually, for a long period of time. And she did not go and seek any medical treatment. And she was pretty much afraid to actually go and see a doctor or deal with it. And in fact, I think would make up reasons sometimes and tell, her children and other family members that she didn't think she needed to, or, she was actually fine, and just like pushed it back. And our understanding, later came to be is that she was afraid to, have to, deal with the medical system and incur all sorts of expenses. Her husband says that she knew something was wrong, and everybody could tell something was wrong. We didn't know what, but she was afraid to find out just because she didn't know how much it would cost to seek real treatment or even have a doctor's visit. So she just put it off and avoided it. And ultimately, we believe that may have cost her her life. Mm. And I come back to the fact myself, I have to look at the fact that her and my mother are twins. So it really struck me when she passed away, because it was somebody so similar to my mother in so many ways. They looked alike, they had similar ways of talking, and they grew up in the same household. But one, on my mother's side, she was able to have health insurance, go off to be able to have a career doing a lot of clerical work in companies that offered health insurance, and my aunt did not. Mm. And so she passed away, and I think it totally would be preventable if we had a different system.
Mm. Thank you for sharing that story, Larry. I've heard you share that story before, and it's so striking, and for the reason that you identified, and all other things being mostly the same, the impact of the lack of healthcare and what that meant for your aunt. To keep going a little bit on this, how do you see the fights for Medicare for all and racial justice interconnected?
I think they're absolutely interconnected, because as I was mentioning earlier, you in this country, it's people of color who are disproportionately without access to healthcare. People of color who are suffering from, environmental injustice and things of that nature that are causing higher rates of cancer. My wife's family lives in Flint, Michigan, where folks were essentially poisoned by their own water system, right? We've got folks in Baltimore City and here in Maryland that have to live next to an incineration plant that's putting pollution into the air. So people of color are suffering as far as the impacts of the system, and it's affecting our health. You've even got statistics that talk about the higher rates of stress leading to higher rates of hypertension, heart attacks, things of that nature. And all too often, we either lack health insurance or are underinsured. And so when we go into like a hospital, like I could walk through what my aunt probably would think about in dealing with the healthcare system. You go to the hospital and then they say, oh, you got something very wrong with you and you're going to have to get this procedure in order to get it fixed. And then if you don't have health insurance, you may not be able to really afford and deal with it. Then you may have to deal with the state bureaucracy in terms of paperwork, applying to get on a certain program, which like if you're just working every day and you don't want to have to like deal with that experience, like you're delayed from getting the care that you need and often denied the care that you need in the programs for low income folks. And then even if you have health insurance, just the costs that go over what your health insurance is able to cover are often absolutely ridiculous for certain treatments. And so people of color are afraid in a lot of ways of even getting sick, and everybody gets sick. So I think it's absolutely important that we view this fight for health justice as a fight for racial justice as well. Justice for all working class people, but it's a shame what's happening to Black and brown folks and Indigenous folks in this country in terms of the like disparate health outcomes.
Yeah, yes, thanks for raising that up. And as you were talking, just reflecting on just the importance of even like preventative care and what it means when you don't go to you're not able to go to the doctor regularly, and when something major happens, and how that compounds both the health emergency that you're facing and then also the cost of that procedure or whatever needs to happen at that moment. So thanks for raising that up. And I'm thinking about what you're saying, and also my mind, I'll go to sort of on the ground and tactics and what this means in our work, and I'm wondering in our organizing, what are your approach? What do you think about how we can actually in our work connect that the fight for racial justice and for Medicare for all, and kind of like what it looks like on the ground?
I'd say it's got to look a lot different than how it currently looks on the ground. I love all people in this country, and I think that this fight for healthcare justice, however, should be a broad representation of the working class in all of its many shades, hues, gender dynamics, whatever it may be. It should be a very diverse movement. However, what I've seen in terms of the fight for Medicare for all, it has been mostly like a white activist kind of movement. And I believe that winning this fight for Medicare for all, which is a very necessary fight for all working people in this country, is going to require a change in how we're organizing and these rooms that we're in, where it's like 90% or above white, are going to have to change their composition, because what we need to win this across the country, we need to, if we have a Democratic majority, again, anytime soon, of course, there's all this gerrymandering going on in certain states trying to, prevent that. So there's also a fight for voting rights and making sure that we have access to the ballot as well. But if Democrats are to get into the majority again, will be absolutely key for winning the fight for Medicare for all in these super blue kind of districts. Many of those districts are made up of people of color, Black folks especially, right? We need to be holding the congressional Black caucuses feet to the fire. They should be walking lockstep with the Progressive Caucus on this. There's absolutely no reason. We're going to need, places with Democratic strongholds that have people of color as a significant portion of their geography or their demography. We need those districts to be on fire for Medicare for all. And that's going to require adding to our base, expanding the coalition here to include people of color. And when you look at what's going on in terms of the healthcare of Black and brown communities, again, just some of these, symptoms of the greater systemic problem in terms of healthcare, there's no reason that, our rooms should look the way that they would look in terms of racial makeup. So I think it starts with our organizing. Absolutely.
Yeah. And have you seen anything, I guess, either in Progressive Maryland's work or the work happening in the campaign around the country that gives you hope that we're moving in that direction? Or is there anything that excites you about what you've seen happening?
Yeah, so some things that excite me about what's happening, I've seen in our state to a degree. We're part of a great coalition, the Maryland Progressive Healthcare Coalition, which we helped to found as well. And where we come in as an organization into that coalition is we're a group particularly focused on, reaching out to communities of color about these issues. And what we've discovered is that it's not that difficult. I think sometimes we make it like it's some type of, trigonometry or something like that to organize people of color for, broad-based social reforms like Medicare for all. It's not rocket science at all. We have to start with going to meet people where they're at and having conversations with them. And also, when we talk about meeting people where they're at, I'm not only talking about the location of where they're at, but where they're at in their position of life. I talked about the practice of hospital lawsuits for medical debts owed and our campaign around that. Part of the reason why we began working on that campaign is we see it as a stepping stone to be able to meet working class people of color where they're at, knowing that so many Black folks in Baltimore City have been getting sued by Johns Hopkins, getting sued by other hospitals in the city, and not able to pay their medical bills, which would be totally different if we had Medicare for all, no question. And so we start by meeting them where they're at in terms of, are you a person who has, had to pay medical debt? Are you a person who currently has medical debt or has been sued for medical debt? And when we would do these outreach sessions, we'd encounter so many people who had stories to tell about the medical debt trap that they've been in, about being sued, about ducking and dodging, these collector calls and everything of that nature. And those are not the folks who are showing up in the rooms for the Medicare for All meetings. I'm sorry to say it.
Mm-hmm.
There can't be this night and day difference when it comes to the impacts of the healthcare system and who's suffering them, and then the folks that are doing the most of the fighting to change that system.
Mm-hmm.
There's no reason that there should be that kind of divide. But we've been working to bring people into that room. And I'm not going to say it's something that's absolutely easy, because good organizing should never be something that's just easy to do. You have to be willing to go and meet people where they're at and bring them to where you're at as well. And that starts first with a conversation, and then, following up with folks, doing the political education work and bringing people into action. And that it takes a lot, but it's worth doing, because that's how we fight and that's how we win.
Yeah, and just a quick plug, because we are People's Action folks, Progressive Maryland, other organizations. We're doing workshops at this conference, and folks who are watching can check out the schedule and see where we're doing some trainings on deep canvassing and how to have some of these conversations with people. And I what you're saying totally resonates with me, Larry, and I think we've been reflecting on that at our organization as well, and thinking about Medicare for All as this sort of broad concept, sometimes that feels very disconnected from the real world hurts that people are feeling. But then when we talk to people about, you're trying to get something covered that's out of network suddenly, or that's way more expensive, or then you can't get pre-authorization. We've been talking to seniors who have Medicare Advantage plans who, suddenly the thing that they need is not covered in this thing that they thought was so great. And it really comes down to having those conversations with people and helping that be the bridge, to the policy and to having these bigger conversations. So yes, plug for those workshops if you're checking out the schedule later. In working with your leaders on this, Larry, how have you seen your leaders at Progressive Maryland sort of stepping into leadership around this issue, and how are they processing this interconnection and talking about it in their lives and work?
Yeah, so in terms of our leaders, that's an important point that you just raised here, because ultimately, like, we have to pull in people who are directly impacted by this healthcare system and bring them into a place in which they're stepping up and helping to lead in the work. I think we're all impacted in many ways by this healthcare system and the privatized nature of it. But there are people who have been, punched in the stomach and just been stepped on by this healthcare system that I think are ripe to be organized. So we've reached out to folks like people who have been trapped by medical debt, gotten them to share their stories, gotten them to reflect on their experiences, and help them to get into action, whether it be being the folks at the forefront testifying in Annapolis to share their experiences with the medical debt trap at the state level, and then also, pulling people in to our training programs as well, because we make a priority on leadership development and training as a core component. So when you talk about folks stepping up to lead in this effort, we can't forget the fact that, people don't just magically become leaders. Some people may have a it's debatable whether somebody may have a natural born talent to lead or something of that nature, but it's our view that oftentimes good leaders are created and molded by the experiences that they have. And so we believe in training being a core component of that, where we have our 3-day trainings and we have our, longer week-long trainings like People's Actions, week-long training, just to give an example, where we help to shape people in terms of recognizing and digesting their own experiences that they've had, and then getting agitated to be willing to move forward and make changes to the system. And I believe the best training to develop folks as leaders is putting it into practice. That's why, as leaders of our organization, within our organization that started our healthcare coalition in the state, who've gone through our training program as well. And now they're hoping to lead and organize others as well, and expanding and growing in that way, right? So it's very important to meet people where they're at and then help to elevate them and help to build a bridge to enable them to meet their potential. That's what we have to do. It's not just activists, but organizers.
Yeah, that intentional leadership development is so important. And I was going to ask you, but I feel like I heard a little bit of it there. What fires up your leaders about working on Medicare for all and healthcare issues? Like, yeah, what gets people excited?
Oftentimes, it's their own experiences with the healthcare system. But like I said, because everybody's been impacted by it in some way. I know members of ours who sometimes, like, even if they have had a history of like having jobs that have good health care that come along with the position, even as like they transition between employers, they'll wind up in a position where they have a lapse in coverage and have a medical emergency. So things of that nature, that's one example of the stories that we hear that get people fired up when they have to actually encounter the system, and then they experience the pain as well. And it's so many people from different walks of life, but especially lower income folks, working class people who have to work jobs that don't make it a priority to treat them very well, like many jobs do. And, folks are frankly sick and tired of the system, but it's not until they encounter us, whether we're going door to door or doing like a tabling event, and we have that conversation where our intention is not just to get a signature from them, not just to get them to sign a card to send off to their representative in Congress, but where we are actually intentionally engaging them and bringing them in. That has been key, because people are fired up based on their experiences. In some cases, they don't know it yet. Because nobody has talked to them and did what we call agitational work, right? Where we get people to recognize like the hurt that the system has imposed on them, and then to be able to recognize that something can be done about that, and it's them that should be doing that something as well. So that's what a lot of our work in organizing is.
Yeah, I'm continually struck by how many people don't think they have a story, and it's when we're talking it through that it comes to light, and how it's all connected. As we're moving to the end here, Larry, so I just wanted to kind of give you an opportunity, any closing thoughts, anything we didn't cover that you want to make sure to share today?
I was just gonna say to like anybody who's here at the conference today, I want everyone to take a moment and just do that reflection work. Like, take a step back and just think about your organizing and how you're fighting for Medicare for all, and whether or not It is very inclusive of the people of color that need to be in the fight. Look around you in the room right now. Do we see the type of diversity that is true about the broad working class in this country? Do we see that represented in the room here? Do you see it in the rooms when you go back into your organizations and into your activism in your community? Do you see the type of diversity that is necessary for us to win? And I want us to take note of that for yourselves and for your organizations, and think of how can we change that? And what's stopping us from building the broad, multiracial, working class power that we need in order to change healthcare in this country for the better? What is preventing that? What is getting in the way? It could be some assumptions. It could be not being willing to step outside of your own comfort zone. And that's okay. But we have to reflect on that and recognize that, and challenge ourselves to reflect and see where our shortcomings are, and then get up the next morning and do better. Reach out to that community in that part of town that you may not have touched yet. Go and knock on some doors, talk to some strangers, talk to some people who may not immediately, get what we're talking about with Medicare for All. Challenge yourself to meet people where they're at and have a conversation. Look up some resources on deep canvassing as well. And, do the necessary work. And it's going to be uncomfortable at times. Be willing to make some mistakes, because you're going to make some mistakes as well. Organizing work is very difficult, but you have to be willing to face that challenge head on. And I know everybody here cares so much about this fight, or else you wouldn't be here. And if we care about it, then we have to be committed at a deeper level to challenge ourselves. So I want folks to reflect on that. People's Action also has amazing affiliated organizations, nearly every part of the country. And those organizations each have a commitment to doing training, leadership development, and good organizing practices. So if you want to be trained to challenge yourself and grow yourself as an organizer, sign up for a training program. Get involved in an effort to organize in your community if you're not already involved. And, that's what I like to share with folks here, because it's absolutely necessary. Last thing is, if we don't do this, we're not going to be able to win. I'm just going to put it point blank. We're not going to be able to win unless we overcome this particular stumbling block in our path. And I know we want to win, because so many people are suffering. So many people are not getting the care that they need, and so many people are dying, frankly. So I want everybody to take this very serious and do different after this conference.
Thank you so much, Larry. That was a powerful reflection and agitation, I think, for all of us. So thank you very much. And if folks watching, if you want to find out more about People's Action's work, check out the agenda for the conference. Groups within our network are hosting workshops on deep canvassing, like we covered earlier, and also on our Care Over Cost campaign. So you can find out more about the organizing efforts happening there and what that looks like. And they're led by leaders from organizations just like Progressive Maryland and Jane Addams Senior Caucus. So hope to see you there. That's it. Thank you all so much for watching, and enjoy the rest of the conference.